Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today's tip is about one of our members. We have a membership for families of critically ill patients in intensive care, where we answer our members' questions when they have family members in intensive care. So if you want to become a member of our membership, go to intensivecarehotline.com, click on the membership link, or go to intensivecaresupport.org directly in the membership. You have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. So let's dive right into the question from one of our members who says, "Hi Patrick and team, my husband tried the bolus feed method today. Prior to that, he had a bit of diarrhea. The night nurse deliberately allowed a lot of air to go into the nasogastric tube and didn't use warm water to flush it. The dietitian was trying to discourage me from doing the bolus feeds and printed a long list of disadvantages. I think they deliberately planned this to happen. His oxygen level went down rapidly, although it came back to 80 to 90%, but they did his ABG. I think it was in the 40s. They transferred him back to ICU and he's back on the ventilator. We're planning on going home and they kept dragging their feet, finding excuses. If this had happened at home, I would have transferred him to a hospital I'm more comfortable with. I will seek to transfer him to a different hospital." Now, I need to give you some context about this email. So this is a client who has had her husband in ICU for many months, initially on a ventilator with a tracheostomy, no PEG tube, only a nasogastric tube. The hospital was trying to send him to LTAC, but the client refused to get a PEG tube. Therefore, the hospital couldn't send him to LTAC, which was a good thing. However, what happened next was quite disastrous because the hospital more or less forced him to go home with no support, right, with a nasogastric tube and a tracheostomy. And whilst we are advocating against the PEG tube for most patients, when you're going home and patients can't eat or drink, right, they do need a PEG tube, right, not a nasogastric tube at home, especially without nursing support, right? I'll come to that and break it down in more detail in a minute. Going home with a nasogastric tube, especially when there's no nursing support, could be disastrous because you need to check where the feeds are going and you need to check the position of the nasogastric tube quite frequently. And that's a skill of a registered nurse, right? Anyway, let's look, and I've made a video earlier in the week, where another client, those two clients are not the different stories, but same situation where they've been sent home with tracheostomies without ICU nurses and they bounce back into ICU. No wonder at all. The context here is, some of you would know we are running a service, intensive care at home, and you can find more information at intensivecareathome.com. There, we send intensive care nurses and critical care nurses into the home, predominantly for long-term ventilated adults and children with tracheostomies, but also for adults and children that are not ventilated but have a tracheostomy. We also send intensive care nurses and critical care nurses in the home for clients on CPAP, BiPAP, and they don't have a tracheostomy. Or we provide home TPN, which is IV nutrition. Can all be done at home. It has to be safe. In those two situations, both clients bounce back into ICU very, very quickly, and it's no surprise because if someone is on a ventilator with a tracheostomy, or with a tracheostomy without ventilator, they need critical care nurses 24 hours a day. And that is evidenced in the mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Currently, with intensive care at home, we are operating all around Australia, in all major capital cities and all around the country, rural and regional as well. But even if you are watching this and you're in the US or in the UK, please reach out to us. We can help you one way or another. We can point you in the right direction, what you should be doing with home care. Okay, let's answer our member's question about, the issues with the feeds and the issues about going back to ICU. And then before I'm losing track here, before we go on to the response, there was a follow-on email from our client, which I actually didn't see in my email thread here. The nurse was the one administering the tube feeds. They were the ones that stated, since I will be taking him home, I should learn. I never took it upon myself to do this. I think it was just a stalling method because we were ready to go home. His wounds are at stage 4, and I requested to go to a different hospital or center. They refused because they don't want anyone to see their negligence on their watch. They keep telling me, we are getting things in place for you to go home. I told the doctor the case managers must be incompetent for taking so long to finalize arrangements. And then she continues, I never administered the bolus feeds. The nurse did. They were insisting that I learn how to administer his medication via the nasogastric tube since I was taking him home, and learn how to change his wounds. And then I realized I shouldn't be doing this. And I said I was going to speak to someone in administration about this. And later the incident happened and they sent him back to ICU. That's why I think it was planned. Hospital staff are something else, wicked to cover their tracks. Well, here's our response. Thank you so much for keeping us posted about your husband's situation. It's good to know that it is the nurse who gave the tube feeding. Therefore, the aspirations were not because of your attempt to feed. You can observe the nurse how they give the tube feeds to your husband, and you have the right to ask and clear some doubts. That will help you learn more about the feeding tube. And by the time your husband is discharged to your home, you can participate and can help and contribute to your husband's daily care. However, he will need a PEG tube, right? He can't go home with a nasogastric tube unless you have 24-hour intensive care nurses. That's when you can take him home with a nasogastric tube. And we have looked after, with intensive care at home, we have looked after patients at home with nasogastric tubes. Nothing we can't do at home, but you have to have the right skill, because if you don't know what to do with a nasogastric tube, if you don't know what to do with a PEG tube, if you don't know what to do with a tracheostomy, could be a death sentence, right? And I'm not exaggerating here. I could give you countless of examples, but let's not get sidetracked here today. It will take time for you to learn how to give the bolus feeding safely, but observing plus demonstrations will facilitate your learning process, especially if you have an interest in knowing the things. Trying to give your husband feeding with the supervision of the nurse will be of great help for you. It will be better if you learn the bolus feeding before your husband is going home from the hospital, so you can participate and provide good care to your husband, including the bolus feeding when he's discharged to home. But once again, strictly advising you should not go home without intensive care nurses 24 hours a day. And keep in mind, the hospital is paying for an intensive care bed at the moment, and they would be interested in cutting half of the cost of that, which is roughly how much intensive care at home costs. The health insurance will have an interest in using intensive care at home because we're cutting half of the cost of an intensive care bed. Now, let's carry on in the email. With your husband's wound stage 4, pressure sore stage 4. Who does the wound care? Wound care must be aseptically done daily at least. Observe the wounds. Are the wounds getting worse or healing well? The wound care nurse and the doctor must assess whether the wounds are healing or need debridement or referral to a surgeon, plastic surgeon, etc. The dietitian or nutritionist also must be involved in prescribing high calories, high protein feeds for your husband that will help with wound healing and repair. Proper wound assessment by the doctors or the nurses to determine whether daily dressings with antiseptic solution and antimicrobial treatments and ointments are needed to facilitate wound healing. While there is no schedule yet for the hospital transfer for your husband, the daily assessment of referral to the surgeon is recommended to determine if there is a need for wound debridement or what treatment is necessary to promote wound healing. Whatever your plan is for your husband, make sure that continuity of care is observed and done to avoid deterioration and severity of his illness. Continuity of care and ensuring his good breathing and ventilation, and the staff or provider that will attend to your husband's ventilation and tracheostomy care. Who will do the suctioning of respiratory secretions, administer nebulizers, perform chest physiotherapy, tracheostomy care dressing, also inner cannula changes, nebulizers, potentially cough assist, and who will do the tube feeding, because you now know if you do it, he will bounce back into ICU. It needs to be done properly. Again, that's what we are here for with intensive care at home. Also, besides the wound care, hygiene, washing, grooming, medication administration, physical therapy and occupational therapy, speech therapy, and many others that need to be considered. The health provider who will do regular visits and assessments of your husband. I hope this helps you. Go and check out intensivecareathome.com. If you're watching this and you are in Australia, we are NDIS, an NDIS approved service provider, also TAC in Victoria, iCare New South Wales, and IISQ in Queensland, and DVA all around the country. We have also received funding through public hospitals, through departments of health, and now also through private health insurance. Please contact us at intensivecareathome.com. Now, and thank you for letting me answer this question from our member here. Now, like I said, we have a membership for families of critically ill patients in intensive care, where we answer all of your questions, and you can get access when you go to intensivecarehotline.com and you click on the membership link, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. I also offer one-on-one consulting and advocacy for families in intensive care, one-on-one over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. I have worked in intensive care for over 20 years, where I have also worked for over 5 years as a nurse unit manager, and I have been advocating and consulting for families in intensive care all over the world for over 10 years now. Now, I also represent you in family meetings with intensive care teams. I will let you know whether you should even go into a family meeting with intensive care teams, because there are indicators that I have learned over the many years where you should go into a family meetings, and other indicators where you shouldn't, probably not even on your radar. In any case, I can represent you in those meetings so that you don't get walked all over, making sure you have clinical representation on your team so that you can make informed decisions, have peace of mind, control, power, and influence. And when I talk to intensive care teams directly, I ask all the questions you haven't even considered asking, but you must ask to have peace of mind, control, power, and influence, and you can make informed decisions. Now, we also offer medical record reviews in real time so that you can have a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. Thank you so much for watching. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have. And all of this you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.